Hi guys, Dr. Jim Wright here. Today we're going to be doing an extraction of a tooth that has an amalgam mercury filling in it. As you can see, this is a severely broken down tooth. Our patient here is a severe bruxer. And what you want to keep in mind is when you're doing these cases, especially when there's missing teeth, is we want to protect the opposing arch from super eruption. So if you have a chance, if a patient comes in on the first visit, it's always nice to get an impression. We still have to trim this, but this is an impression of his mouth. So we're going to make him an Essex while we're doing the surgery today. So then he'll leave with an upper Essex so that will prevent the upper molar from super erupting. Today what we're going to be doing is we're going to be removing the mercury amalgam filling. It has a periapical lesion and it's severely broken down. So let's take a look inside. I'm going to click out of here for a second and we're going to go to our images. And this is our image from the last time when he was in. And I think I'm just going to retake a couple right now while we're here. So, Jose, abre por favor. Okay, so you always want to make sure when you take a picture, dry the tooth so you really get a good look at it. So we could see that it's really broken down here. Now I'm going to get a new. So it's fractured, infected, and I'm just going to get all the way in there. So anyhow, we're going to, that's what we're going to be extracting today. Let me annotate this. Okay, and so when we do our extraction today, we're going to be regenerating his tooth as well. So we're going to be using his tooth for the graft afterwards. So you can see the periapical lesion here. It's pretty severely broken down. Once I get the amalgam out of here, we're going to see where we are. I'm going to still try to extract this tooth with just using an elevator. I may have to section it. I'm hoping to not have to because the gutta percha here, I'm going to have to remove when we do the regeneration. So we're going to lose some tooth structure when I get in here to remove the gutta percha. So we'll find out when we get in there. But anyhow, most importantly right now, we're going to go through our protocols. We're going to put our dam on, and then we're going to remove this huge amalgam mercury filling first off. Okay, thumbs up, we're ready to roll.